Hi there, this is Nursing Education Videos. Today I will be going over the hypovolemic shock NCLEX questions for nursing students on Registerednursern.com. So the specific title is Hypovolemic Shock NCLEX Questions. I will be reading the review notes and doing the quiz at the same time. I hope this information is helpful for your learning. All credit for this information that I am reading goes to Sarah at Registerednursern.com. Again, all credit for the information that I am reading goes to Sarah at Registerednursern.com. Please refer to the websites in the description box for all credit and information. Links for the information will be included in the description box. So this quiz will test your knowledge on hypovolemic shock. Hypovolemic shock occurs when the intravascular system has been depleted of fluid volume. This causes the cardiac output to fall below the parameters needed to maintain tissue perfusion. This leads to cell hypoxia and eventually multiple organ dysfunction syndrome, MODS, and death. There are various types of shock: cardiogenic, hypovolemic, anaphylactic, septic, and neurogenic. Don't forget to watch the hypovolemic shock YouTube video on YouTube as well as Registerednursern.com. Don't forget to watch it before taking this quiz. Question number 1. True or false? Hypovolemic shock occurs where there is low fluid volume in the interstitial compartment. So we will double check the NCLEX review notes. So on the notes here, it says any condition that leads to fluid leaving the body externally, or there is shifting of fluid within the body that leaves the intravascular space. Let's see if there's the word interstitial compartment. Yeah, I don't see the exact wording of interstitial compartment on hypovolemic shock NCLEX review. We'll double check it on Google. So Google says extracellular. So there's a relative hypovolemic shock. This is an inside fluid shift from the intravascular system. From this information, I could go with true. And then hopefully it's correct. 2. As the nurse, you know that in order for hypovolemic shock to occur, the patient would need to lose blank of their blood volume. So A, less than 30%, B, greater than 25%, C, greater than 15%, or D, greater than 10%. So the numbers here are 15, 15 to 30, 30 to 40, and 40%. So class 1 is less than 15% of volume loss is considered hypovolemic shock class 1. So right now we could omit D because that's greater than 10%. Maybe. So it says here, a person needs to lose about 15% or more of their intravascular volume for hypovolemic shock to occur. So it would actually be C. And then question 3. If a patient has a blood volume of 5 liters and loses 2 liters, what is the percentage amount of volume loss this patient has experienced? A, 25%, B, 40%, C, 30%, or D, 10%. So 2.5 liters of 5 liters is equals to 50% loss of volume. And then if we go 2 liters divided by 5 liters, what would we get from the calculator? It would be 40%. So it would be B, 40%. Question number 4. A patient who is experiencing hypovolemic shock has decreased cardiac output, which contributes to ineffective tissue perfusion. The decrease in cardiac output occurs due to A, an increase in cardiac preload, B, an increase in stroke volume, C, a decrease in cardiac preload, or D, a decrease in cardiac contractility. So It would be probably C. So a decreased cardiac output what causes a decrease in cardiac output is likely because it is due to a decrease in cardiac preload. Because if we go through the answers here, answer A, an increase in cardiac preload would probably increase cardiac output, and an increase in stroke volume would probably increase cardiac output. A decrease in cardiac preload would probably be decreased cardiac output. But let's see if I can find the exact wording. Okay, so I Googled it on www.sciencedirect.com about Frank Starlin law. Preload reduction generally results in a decrease in cardiac output. So I would go with C. And then question number 5, true or false? A patient with acute pancreatitis is presenting with Turner and Cullen sign. The patient is at risk for absolute hypovolemic shock. This would be false because this is an absolute hypovolemic shock. But on the review notes here, it's patients who have Turner and Cullen sign would be at risk for relative hypovolemic shock. Then question number 6. Select all the conditions below that increases a patient's risk for absolute hypovolemic shock. So this is an outside fluid shift from the intravascular system that leaves the body. So if we think of absolute hypovolemic shock as the volume absolutely leaving the body, it could be due to burns, vomiting, long bone fracture, surgeries, and diarrhea. So the answers here on the review notes: massive bleeding from injury or surgery, excessive fluid loss from vomiting, diarrhea, urine, sweating, So I think those are the correct answers. Question number 7. A patient has a 10% loss of their blood volume. Select all the signs and symptoms this patient may present with. So this would be a class 1 hypovolemic shock because it's less than 15%. So blood pressure within normal limits. Maybe a little anxious, so anxiety. Capillary fill still less than 2 seconds. Urinary output is normal, so greater than 30 milliliters per hour. And the skin is still pink and warm. So the answers would be B, C, D, and E. Probably not C, because C it says anxiety, but this says maybe a little anxious. So it could be B, D, and E. Question number 8. During what stage or class of hypovolemic shock does the sympathetic nervous system attempt to maintain cardiac output? It would be starting at stage 2. So the answers are either A, stage 1, B, stage 3, C, stage 4, or D, stage 2. Class 1 is the patient is mainly asymptomatic with this class, but then on class 2 is when there is compensation that occurs. So the specific statement here, there is a major body system compensation via the sympathetic nervous system. Question number 9. One of your patients begins to vomit large amounts of bright red blood. The patient is taken warfarin. You call a rapid response. Which assessment findings indicate this patient is developing hypovolemic shock? Select all that apply. So vomiting large amounts of blood, you're losing fluids here. Patient is on warfarin, risk of bleeding, increased risk of bleeding. So developing hypovolemic shock. Okay. Answer A is temperature of 104.8 Fahrenheit. B, heart rate of 40 beats per minute. C, heart rate 140 beats per minute. D, anxiety, restlessness. E, urinary output of 15 milliliters per hour. F, blood pressure of 70/56. G, pale, cool skin. H, weak peripheral pulses. I, blood pressure of 220/106. So if we go over the class information here, is that at class 2, the heart rate will become tachycardic due to the effects of this sympathetic nervous system. So we would go with C. So increased heart rate greater than 100 beats per minute. Blood pressure decreases, but within normal limits. Further developing hypovolemic shock is hypotension. So F. And then anxiety and restlessness would be one of the answers. So D. Urinary output of 15 milliliters per hour. So that's when their urinary output slowly decreases because they want to retain fluid. The body's trying to retain fluid because it's losing too much fluid, so their urine output would decrease. So it would be E. They would be having pale, cool skin because there's not enough blood going through their circulatory system to get to their skin. That's why they have low blood pressure. So they would be having pale, cool skin. And they would probably be having weak peripheral pulses as well, because there's just not enough volume for the blood to reach to the pulses. So not enough blood to reach to the extremities. So it would be answer C, D, E, F, G, and H. 10. You're providing care to a patient who has experienced a 45% loss of their fluid volume and is experiencing hypovolemic shock. The patient has hemodynamic monitoring and fluid resuscitation is being attempted. Which finding indicates the patient is still in hypovolemic shock? A. Low central venous pressure. B. High pulmonary artery wedge pressure. C. Elevated mean arterial pressure. Or D. Low systemic vascular resistance. So this is 45%. So this would be a class 4. According to his website. So death is very near, needs very dynamic treatment. The body is shutting down. The fluid loss is severe. So which finding indicates the patient is still in hypovolemic shock? Probably a low central venous pressure. And then this is a question that asks you to find one answer versus the previous question asks you to select all that apply. This one asks for one, so it would be A, low central venous pressure. Then question 11. A patient is 1 hour post-op from abdominal surgery and had lost 20% of their blood volume during surgery. The patient is experiencing signs and symptoms of hypovolemic shock. What position is best for this patient? A. Modified Trendelenburg. B. Trendelenburg. C. High Fowler's. Or D. Supine. So we're going to go through the notes here just to make sure we find the correct information. Again, Dylan. So if showing signs and symptoms of hypovolemic shock, place in modified Trendelenburg. Position feet at 45 degrees, head flat, which would increase venous return to heart and cardiac output. That would be A. Then question number 12. A 35-year-old male arrives to the emergency room with multiple long bone fractures and an internal abdominal injury. The patient is anxious. Patient's vital signs are blood pressure of 70/54, heart rate of 125 beats per minute, respirations of 30, oxygen saturation on 2 liters is 2-liter nasal cannula is 96%. Temperature of 99.3 Fahrenheit. Pain is 6 on a 1 to 10 scale. During assessment, it is noted the skin is cool and clammy. The nurse will make it a priority to A. Collect a urine sample. B. Obtain an EKG. C. Establish 2 large bore IV access sites. Or D. Place a warming blanket on the patient. So patient's blood pressure is low, 70/54, and a heart rate of 125 beats per minute with respirations of 30. So your priority would probably to establish 2 large bore IV access sites so that the patient could have some fluid infusions to help with the blood pressure. I will double check the information over here. So obtaining IV access, so at least 2 IV sites that are large, 18 gauge or bigger in large vein like anticubital, needed for rapid fluid delivery and other medications. Many patients with severe hypovolemic shock. And then it says collect labs, hemoglobin, hematocrit, lactate levels, blood gases. Let's see if this says anything about urine sample. Doesn't say that. EKG is also not mentioned to be a priority. It also doesn't say that warming blanket is priority either. So it would be C, establish 2 large bore IV access sites. And then question number 13. A patient in hypovolemic shock is receiving rapid infusions of crystalloid fluids. Which patient finding requires immediate nursing action? A. Patient heart rate is 115 beats per minute. B. Patient experiences dyspnea and crackles in lung fields. Or C. Patient is anxious. Or D. Patient's urinary output is 35 milliliters per hour. So when a patient requires fluids and they receive a rapid amount of fluids, it can put them at risk of fluid overload, I think. So what findings would be with fluid overload? We could double check that in the notes here. Rapid infusions. So if we look at the nursing interventions, because this is an intervention, we would watch for fluid volume overload when administering crystalloids. And one of the findings would be crackles. So which one would require immediate nursing action? It would probably be the dyspnea and crackles in the lung fields. And also getting the definition of dyspnea on Google, it's the shortness of breath. So when patient experiences shortness of breath and crackles in the lung fields. and this is on mayoclinic.org, as well as wikipedia.org. Question number 14. A patient has lost 750 milliliters of blood volume. The MD orders normal saline infusion. Using the 3-to-1 rule, how much crystalloid solution should be prescribed by the doctor? A. 2,250 milliliters of normal saline. B. 250 milliliters of normal saline. C. 375 milliliters of normal saline. Or C. 1,225 milliliters of normal saline. So if we go back to the notes here, we look 3-to-1 rule. That rule is for every 1 milliliter of approximate blood loss, 3 milliliters of crystalloid solution is given. So there's a 750 milliliter loss of blood times 3. We would be giving 2,250 milliliters of normal saline. So that would be A. This might even make more sense if it was the 1-to-3 rule, because if it's blood volume on the left side and then crystalloid solution replacement on the right side, in this question it would make more sense that way, to me at least. So it would be 2,250 milliliters of normal saline to 750 milliliters of blood volume. Question number 15. You're providing an in-service to new nurse graduates on the fluid treatment for hypovolemic shock. You ask the participants to list the types of crystalloid solutions used in hypovolemic shock. Which responses are incorrect? Select all that apply. A. Albumin. B. Lactated ringers. C. Normal saline. Or D. Hetastarch. So there are the difference between crystalloids and colloids. So crystalloids are normal saline or lactated ringers, and then colloids are albumin and hetastarch. So which responses are incorrect for naming a crystalloid solution? It would be A. Albumin, as well as D. Hetastarch. The two crystalloid solutions are lactated ringers and normal saline. 16. Select all the fluid types below that are considered colloids. So that would be albumin. So A. Fresh frozen plasma. B. Albumin. C. Normal saline. D. Lactated ringers. E. Hetastarch. F. Platelets. I would cross C and D out first, because from the previous question we know they're not colloids. Albumin is 1, so B. Hetastarch is 1, so E. And on the notes on registerednursern.com, fresh frozen plasma as well as platelets are listed under the colloid section. So it would be A, B, E, and F. Question number 17. Which statement is true about colloid solutions? Select all that apply. A. These solutions are made up of large molecules that cannot diffuse through the capillary wall, so more fluids stay in the intravascular space longer when compared with the action of a crystalloid solution. B. These solutions can diffuse through the capillary wall, so less fluid stays in the intravascular system when compared to the action of a crystalloid solution. C. The nurse should monitor for an anaphylactic reaction when these products are administered. D. These fluids are considered hypertonic solutions. So this is a question where we select all that apply. So it'd be A, C. So the nurse should monitor for anaphylactic reaction when these products are administered. And then double checking the information here too, or checking, just reading the information over here too. Yeah, it doesn't say anything about hypertonic on the website. So it would be A and C for question 17. And then question 18, a patient is receiving large amounts of fluids for aggressive treatment of hypovolemic shock. The nurse makes it a priority to A. Rapidly infuse the fluids, B. Warm the fluids, C. Change tubing in between bags, or D. Keep the patient supine. So we'll look at the nursing notes here. So it says on the nursing interventions needed for rapid fluid delivery and other medications. It doesn't really say anything about changing tubings, and it's not about keeping the patient supine because the intervention is modified Trendelenburg to increase venous return to the heart. So it would be A. Rapidly infuse the fluids. 19. The patient with hypovolemic shock is in need of clotting factors. Which type of fluid would best benefit this patient? So in clotting factors, it would be A. platelets, B. albumin, C. fresh frozen plasma, or D. packed red blood cells. We'll review the information here. Platelets is for uncontrolled bleeding to help with thrombocytopenia, so A. Alright, and then now we'll double check, and then now we'll input the answers. Alright, hopefully we can score 100% while reviewing these questions here to know that we know where to find the information. Whoa, well, we found out we got, here are your results. Your grade is C. Percentage of what you got right is 74. So that is a little, that definitely doesn't feel good. So let's find out what we got wrong. Alright. So what we got wrong is true or false. Hypovolemic shock occurs where there's a low fluid volume in the interstitial compartment. The answer is false. And I wrote true. And then select all the conditions below that increases a patient's risk for absolute absolute hypovolemic shock. So I wrote burns and long bone fractures. Those were incorrect. So the correct ones would be vomiting, surgery, and diarrhea. I would think fractures would be an injury. That's why I kind of got confused about that one. And then question number 16, select all the fluid types below that are considered colloids. So I only wrote albumin and so the only ones that are considered colloids are albumin and hetastarch. Fresh frozen plasma and platelets would be considered blood and blood products. And then number 18, a patient is receiving large amounts of fluids for aggressive treatment of hypovolemic shock. The nurse makes it a priority to, and the answer would be to warm the fluids. Yeah, if giving large amounts of fluids, need to warm them for colloids. Why? If not warmed, it can lead to hypothermia, and this will alter clotting enzymes. Keep the patient warm, but not to the point of sweating. And then number 19, the patient with hypovolemic shock is in need of clotting factors. Which type of fluid would best benefit this patient? It'd be fresh frozen plasma, C, instead of platelets. They need clotting factors and not for uncontrolled bleeding. So fresh frozen plasma for clotting factors. Alright. Yeah, it's a good learning experience for myself as well. I find that when I make mistakes, I could review the information and find out why I made that mistake. Was it, did I read it wrong or did I understand it wrong? So thank you for listening. I hope this information was helpful and engaging. Please feel free to subscribe and click the like button and go to registerednursern.com for more information and check out their YouTube channel. I hope everyone has a good day. Thanks again for listening.